Hi everybody, my name is Raja, and the topic that I'll be presenting on today is Crohn's disease. To start, I'm going to present my case study patient. His chief complaint is that he has a fever and really bad pain in his belly. Our subjective findings is that he's a 21-year-old male presenting with the complaint of severe abdominal pain that began 2 days prior and a fever for the last day. The patient has had loose stools for a few weeks, and melena, that's blood in the stool, began 2 days prior. Patient reports pain in all quadrants of the abdomen and describes his pain as crampy and stabbing. He rates it a 7 out of 10 and reports no alleviating factors. He also says that pain is aggravated after eating. He denies any referred pain, and he also denies problems voiding, sore throat, respiratory stress, emesis, and eating anything abnormal. Part of his objective, we gained a history, a medical, family, and social history, and it revealed that he has a history of asthma and has been prescribed an albuterol meter dose inhaler as treatment. His father had uncontrolled hypertension and died of an MI at 55. His mother has a history of chronic depression. We also found out that he's a senior in college living with 6 roommates, and he lives a 4-hour drive from his parents and the rest of his support system. To start our discussion more into what Crohn's disease is, we are going to begin with a question. The patient's abdominal pain is most likely caused by A, abdominal muscle cramping, B, allergic reaction to food, C, severe intestinal inflammation, or D, decreased blood flow to intestines. Give you guys a second to pause the video and think about that, and then we'll get to the answer. So hopefully you're able to pause the video and think on that for a second. The answer is C, severe intestinal inflammation. Not A, abdominal muscle cramping, because what's causing the pain is not his muscles themselves on the outside of his abdomen, but it's the intestines inside and those muscles that are causing him pain. Not an allergic reaction to food, because we found out in his subjective that he has not eaten anything new recently, and in his history, he has no history of any food allergies. And then it's not D, decreased blood flow to the intestines, because in Crohn's disease, blood flow is able to continue to the intestines. It's the inflammatory process that is most likely causing his pain. All right, so what is Crohn's disease? It is a chronic disease that causes inflammation and ulceration in your digestive tract. The cause is unknown, but it may be related to an autoimmune reaction. So your immune system is attacking healthy cells, and this creates these ulcers and what are known as fistulas, where all 3 layers of your intestinal mucosa and muscle are degraded, and the contents are allowed to leak into your abdominal cavity. And what makes Crohn's disease special and somewhat more serious than some other intestinal tract disorders are that these patches of inflammation, as you can see here, they skip around, and they can skip around your entire digestive tract from your mouth to your anus, creating these ulcerations. And so that makes it really hard to treat. It is a form of inflammatory bowel disease, which is a umbrella term for diseases of the bowel that cause an inflammatory process. But it can be named based upon the region it primarily affects. So there's regional enteritis, ileitis, ileocolitis, and diffuse jejunoiditis. And again, Crohn's disease, because it is named after its discoverer, a gastroenterologist named Burrell B. Chron, it doesn't follow traditional medical naming, but the subcategories that we just learned about use the suffix itis, and that signifies inflammation. So again, this is an inflammatory disease. All right, so what are the symptoms of Crohn's disease? They can vary based upon the location and severity of the inflammation, but common symptoms include abdominal pain and cramping, diarrhea, melena, which again is blood in the stool, tenesmus, which is a frequent urge to have a bowel movement, unintended weight loss, and because you lose your appetite, you're not wanting to eat, anemia, that is caused by bleeding of the intestines into your abdomen, and that blood loss can lead to anemia, fever and fatigue as a result of your immune response, joint pain or soreness, and then loss of appetite. Think about it. If you are having all this abdominal pain and cramping and it's getting worse every time you eat, you might lose your appetite and not want to eat as a result. A physical exam of a person with Crohn's disease would reveal bloating in their abdomen, hyperactive bowel sounds. So that's, you would actually listen to the bowel with a stethoscope, and you would hear gurgling and loud noises that are abnormal. You would also, if you palpated the stomach, find tenderness and pain to the abdomen, and you may be able to palpate an enlarged spleen or liver. The spleen is found in the right upper quadrant, and the liver is found in the right upper quadrant, and the spleen is found in the left upper quadrant. So palpating those areas, depending on the severity, you may find those symptoms. An exam would also include blood tests in which you would find elevated C-reactive protein and white blood cells as a result of the immune response, decreased iron and complete blood count as a result of the blood loss. You would also do stool tests, and you would find elevated calprotectin. And then one would also do a colonoscopy and a CT scan. Both of these are going to find the presence of granulomas, which are collections of infected cells that glob together. And then in a colonoscopy, you could also see ulcers, which are those degradation areas in the mucosa that are very severely inflamed. On this next slide, I have pictures of that imaging. So here we have a CT scan. And if you look where this arrow is, you can see this burst of cells. That's a granuloma on this imaging. And then here we have colonoscopy images. These top two are images of a normal colon. On the bottom here, we see severe ulcerations, all these tears in the mucosal layer. And then here we can see there's some ulcerations, and then we also have the formation of these granulomas. So these two bottom ones would be positive colonoscopies for an inflammatory disorder, like Crohn's disease. So how do we treat this? There is no cure. Again, it skips around in the intestine. It's very hard to treat, but there are a lot of things we can do to reduce the effects. So you can use medicines, surgeries, nutrition's a big one, and then also bowel rest. Medicines to treat it would be non-steroidal anti-inflammatory drugs. Other anti-inflammatories as well may work. This is just to reduce the immune response. Antidiuretic medications, antibiotics, because infection can often result from the leakage of your intestinal contents into your abdominal cavity in severe cases, and then immunosuppressants to reduce autoimmune response that may be happening. In severe cases, you could have surgery to remove part of your digestive tract, typically the part that's most effective to treat fistulas, life-threatening bleeding, or intestinal obstructions. And then nutrition is very important. You want to consume a low-residue, lactose-free diet. A low-residue diet means that you don't involve foods that are going to increase your stool output. So you would limit fiber to 10 to 15 grams per day, limit dairy to 2 servings a day or less, and then also you would want to limit some of your protein intake to around 2 servings. And you would want to choose tender options such as tofu, eggs, fish, and ground meat. You do have increased caloric and protein needs because your body needs extra energy and extra protein to heal your tissues. Supplementation with glutamine and arginine are recommended because these 2 amino acids play an important role in wound healing. And you would want to supplement with a multivitamin because often vitamin absorption is altered as a result of this damage and destruction to your intestines. And then bowel rest would also be indicated in severe cases. This is where you would drink only clear liquids for a few days, sometimes longer. And in very severe cases, they would restrict all oral intake and put someone on enteral or parenteral nutrition. Enteral nutrition is tube feeding, so you would get a tube into your mouth or nose all the way into your stomach. And you would be fed through that. And then parenteral nutrition is often used in these cases because it's IV feeding. So in that case, nothing ever enters your digestive tract. It just goes straight into your blood for absorption. So that will allow your bowel to rest in those times of severe exacerbation. All right. Thank you guys so much for listening. Here are my references. Have a great rest of your night.